Hi, I'm Dr. Jordan Alger. I'm a urologist here at Urology Associates. I grew up in Baltimore, Maryland originally, and was born and raised there, and then went to college and did my undergraduate training at Rice University in Houston, Texas. I then spent some time in Houston working actually as a high school teacher before I made the transition to medical school. First at the University of Maryland, where I did my medical school training, and then I did my residency at Georgetown University in Washington, D.C. I come from a family of educators. My grandfather, both my parents were professors, academics, and I always had an interest in that and felt a strong connection to teaching those in the classroom and kind of educating people. And I think that interest in education has continued in my career now as a urologist as I continue to educate my patients. My mom is a physician actually, and so that was my first kind of introduction into medicine as a career. And it was after a few years of teaching where I felt an interest in continuing to work with people, but also having a genuine opportunity to solve problems, to use my hands. And I think that that's kind of what interested me in a career in medicine. I met a urologist who happened to be just a great role model and mentor who really taught me a lot about the field, taught me a lot about the kinds of conditions they treat, the use of the robot. It seemed very compelling and very interesting. And when I learned about the true breadth of urology and the number of conditions you can treat, the sorts of technologies that they use, and the way you can really make a big impact on people's lives and their quality of life, I was, smitten. Some of the common conditions that I treat as a urologist are enlarged prostates in men, voiding dysfunction or urinary problems. Kidney stones are obviously very common, erectile dysfunction as well. I do see women with various urologic conditions, including malignancies, stones, urinary troubles. Prostate cancer is one of the most common conditions men face as they get older. So we see a lot of prostate cancer, and certainly one of the main modalities for prostate cancer treatment is robotic surgery. And I think that was one of my first interests in the field, was not only the workup and treatment of prostate cancer, but then also the follow-up afterwards and the additional care that you have and the relationships you establish with these patients. My patient care philosophy is that I think patients do best when they feel comfortable and when they feel well informed about their condition and what the options are available to them. And so my personal mission is to try to educate my patients well, answer their questions, and make them feel comfortable. These are conditions that many patients are dealing with, that they're not alone. Second thing is, I think it's always nice to have a little bit of humor. I'd be lying if I said that wasn't one of the reasons I went into urology, because I think that having a sense of humor and not taking yourself too seriously is an important part of being relatable. When I'm not at work, I spend pretty much as much time as I can with my wife and 2 children. They're both full of energy. They do a variety of extracurriculars and sports, and we play games, we have fun, we go outside together. We're just a very active family, and we really have a good time laughing together and listening to music. We generally have always enjoyed spending time outside, hiking together. We play a lot of sports. My wife is an athlete in college. I've played sports my whole life, so me and the kids and my wife, we're always out in some kind of field or playground doing something together.